Right.
to
Yeah.
the neurologist. And what it does is tries to clean out the antibodies from the blood.
Right.
In addition, he put her back on steroids, and I think actually increased the dose to try to suppress the immune system from
It's helping.
Yeah.
causing this.
Yeah, they're definitely helping.
That
Yeah.
being said, it still takes time to recover
Well, yeah.
from this. We're still having issues with the swallowing, but she's at least off the ventilator and getting a little bit stronger. So that's
Yes.
number one on my list. Does that make sense?
It does, but the swallow study that she just did, do you have the results for that?
I do not yet.
Okay, yeah, that was just like a half an hour ago.
Therapist that gives us the results on that.
Oh, okay.
And until that gets better, we're stuck with the tube in the nose for feeding because if it's not safe to swallow, then
Right.
there's a risk of causing pneumonia.
Do you still have her?
See evidence
Okay.
of that in the ICU, and she's actually on an antibiotic for as well, but that's further down my list.
Oh, wow. Okay. Like, has she been tested for a UTI or anything? Because she seems to be suffering from the hospital delirium.
Results, but where there was concerns for confusion yesterday, I've actually ordered a urine to look for it.
Okay.
See if there's urinary tract infection. The antibiotic she's on for the pneumonia would likely cover anything, so I don't think
Okay.
in that, but I'm actually in the process of looking for that.
Okay, excellent. Yeah, that's what I was
Yeah,
hoping to
because
hear.
she's it's way different
'Cause,
the
yeah.
last couple days.
I mean, if a month ago she was working 40 hours a week, holding down a job, driving to work, and now we're at where we're at now.
Yeah.
And it just seems to have snowballed
I also
really
did
fast.
a head CT scan earlier because of the concern for confusion, although she was firmly oriented when I talked with her, and I'm suspicious confusion may be delirium, where it kind of waxes and wanes, and it's usually because you're sick from other reasons.
Right.
But I didn't see anything big, bad, or scary with the head CT scan.
Well, that's
Good,
good.
good.
That's very good.
The thing on my list, though, is the concern for breast cancer. When they were doing imaging as part of the usual workup for the myasthenia gravis, we saw a mass in the breast and spots in the lungs that looked like it could be breast cancer. So what we did is we got the oncologist involved. I think they just started just the last day or two here, and looking for advice from them where to go next. Because I'm not a cancer doctor per se.
Right.
We need to get a piece of it, a tissue sample somehow, but we're trying to figure out where the best spot to do that is. And so the oncologist has asked for different imaging, an MRI of the liver, a bone scan, and to try to figure out where the best spot to take a piece from.
Can we not take a piece and do a PET scan instead?
You can't do those in the hospital, unfortunately.
Okay, but we can get.
Quit paying for them, and so they don't even have them here now.
Oh. Okay, because the summit.
Stable enough to leave, which I don't think she is.
Right.
Well, that's yeah,
Stuck.
exactly.
Yeah.
Basically, I'm looking to the oncologist to say where would be the best spot for to try to get a piece of it.
Okay.
Also, once they give a recommendation, run it through with the radiologist where they think a good spot to get it is, and then we'll order the radiologist to actually get a tissue sample.
How about we take her off Neurontin for a while and get her better?
Sorry, say that again.
Can we take her off of Neurontin or at least quit overdosing her on gabapentin and Lexapro?
Yes, we can actually.
Thank you.
For her home meds.
No, she didn't even take that many, and they've been overdosing her the whole time she's been in here, and I think that she would snap right out of it, and you're the first one that actually listened to me. Thank you.
I will, as soon as I can sit back down to a computer. I did not realize those were new meds. That absolutely is
Thank you.
Yes.
I was right.
Okay,
Thank you
well,
for listening.
Thank you for listening, because the other
Jeez.
people have just brushed us off like we don't know, because we're family.
Yeah.
You know?
Those are more for symptomatic meds, and honestly, even
Yeah.
antidepressants they take forever to work. How long has she been on the Lexapro, though?
Years. I'm
yeah,
finding
several years,
Tons.
yeah.
She told
Yeah.
me that she didn't take very many, but there's tons of empty bottles at home.
Yeah.
So I don't
So
know.
I may have. Let me look at the dose on that when I find it.
When she took it at home, if she took one, she only would take one every now and then. She didn't take them regularly.
Okay. Yeah. Okay.
Thank God.
Sorry, you were saying something when I started. I missed it.
Oh, she
I-
at home she would only take one of the Lexapro.
Not
and
three
and
times
she
a
wouldn't take
day.
it regularly.
Yeah.
You know, like just every now and then.
Okay.
And so if she's taking
And
3
it's
a
not,
day
do-
now,
yeah.
then that's way
It's
more.
way too much, and that's what they've been doing ever since they were giving it to
Yeah.
her liquid.
Yeah.
So,
Let me look at the dose.
Okay.
And like I say, that's something that sometimes we have to taper to avoid. With
yes, and
Oh,
I
right,
understand
yeah.
that. I understand that.
On this dose too.
Yeah.
And definitely we can cut back on that. I think
Great.
it's an excellent idea.
Thank you.
Yes.
Yes,
Awesome.
I
Yay.
thought so.
I wish you were here in person.
Okay, and then
Yeah.
and then some
I am around. I'm just still trying to get everybody.
Oh, okay.
And then-
more tight.
and then what's the difference between
Other thing on my list is
Sorry,
also
okay.
on the CT scan, they saw some thickening of her cervix, which is like the cervix.
Yeah.
That's not normally a spot we would think breast cancer would be. It was kind of questionable whether this is even related or not. The oncologist recommended having gynecology see her and consider a biopsy at that point, in addition to a spot elsewhere in the body. I called the gynecologist earlier today. They wanted a transvaginal ultrasound, and they will follow up on that result tomorrow and say whether they think we need a biopsy at all, or now, or down the road.
No.
Okay.
Okay, well, can we do that when she gets strong enough to walk out of here?
Because she said she's not
I'm-
having any spotting or
And I
discharge or
don't-
anything like that.
This has been like a rabbit hole, and I
If
don't
we-
want to do anything more to her until she can stand up and walk, a little, you know, like to go
And
home.
swallow.
And swallow, be unhooked from the machine, and then we'll go in and take care of all the other stuff. I really don't want her being poked anymore.
To some degree, no. Let me see what the surgeon says tomorrow.
Okay, thank you.
Okay.
With the potential for breast cancer, I feel like we should sort that out because this may take a long time before she,
Well, there's a lot. Yeah, I know, but
the strength in recovering from myasthenia gravis, that could take weeks, and I'd hate to delay.
she's not gonna last in here for weeks. She's done. She's ready to go home. Weeks? I don't know. Okay.
Okay. So
Okay.
at least we have a plan, right?
Yeah.
Yeah.
I would recommend we at least pursue the sample of breast cancer.
Right.
More of an incidental.
I want a second opinion.
Oh,
Let me at least see what the surgeon recommends before we actually do anything then.
yes.
Yes, because
Absolutely.
yeah,
Okay.
I want
Yes.
that to be the last. I really am very adamant about not taking a biopsy because I've already got an appointment, and as soon as she signs a thing, the doctor with the PET scan will come up and look at her records. So I don't want them poking her anymore if they don't have to.
Even for the breast cancer biopsy?
Yeah, because that's what the Summit Cancer, they have a PET scan, and they said that they would come up and look at her records about the cancer.
You said Summit Cancer?
Yeah.
Okay, that's a different, okay, I didn't know she was involved with them.
She's not
Right.
because we
She's-
didn't
We
know.
didn't get the papers signed today, but we've been in
No.
contact with them, and they said they're
Yes.
willing to come up here and look.
Okay.
Yeah.
All right, let me touch bases with my oncologist there tomorrow. They're probably not here today at this point.
Okay.
So the ICU team, when they consulted oncology, they actually called a different cancer group.
Oh.
Cancer care. And so if you guys want to pursue more with the other group, I should see if they have somebody in house to work with us.
Yeah.
Okay. Okay.
Yeah, we're gonna go
Yeah.
out of house for a second opinion though.
Okay, my doctor, the other doctor here said that
You don't have to hold it. You can just. Okay, there.
A little closer to the phone.
There.
Yeah, there we go.
Trouble hearing.
The other end. Other end. Yeah, right
he
there.
says, my doctor said that the surgeon, he said that if I could swallow, he'd get that tube taken out of my nose, and I could go home. Is that still the same story? Because I think that going home, the American
Way better.
Yeah.
So the swallowing will depend on how much stronger you get from the myasthenia, and that may happen soon, and that may take a while, and I don't really know the answer. As far as going home, it also depends how well you can get up and move around, whether it's safe to go home, and I use my therapist to kind of get you up and move you and try to determine where we are with that. I worry that you're still a bit too weak for that, to be honest.
Okay.
Yeah.
Yeah.
I'm not gonna let
Well,
him
this
make it
has
any
to
worse.
come to an end pretty soon.
Yeah. She's ready to go.
Yeah.
She wants to get out of here.
I wanna at least be able to go home for a few days, spend some time with,
Again, I couldn't hear you.
She wanted to go home for a few
to
days.
go home for a few days and spend time with my family, and then come back and then follow it
I
up.
really wouldn't recommend that yet. I don't think you're well enough.
Well, yeah, we're not gonna do
Yeah.
anything stupid.
No. It's her birthday on Tuesday.
Yeah.
She wants to be home for her birthday.
I'm sorry.
Yeah.
Yeah.
You know, they used to do day passes from the hospital. They're not allowed anymore.
Oh, wow.
Even
They
with
used
the
to do day
doctor's
passes.
order, we can't do that just from a liability standpoint.
Right. I
But I
understand.
don't think it's safe. It's considered against medical
Yeah.
advice, which must be done.
Oops.
But I really hate to do that.
Right. Well, if we could maybe have a look at those prescriptions and get those like
First of all, let's see
weaned
what
down.
happens with
Yeah.
the swallow test.
Okay. Yeah.
On that yet.
She's cutting out.
As far as how long
Hold
it
it up.
takes to get stronger, really the neurologist is the one I look to more to tell us, give us a guidance on that. But
So
in
yeah.
a while, especially when you've been this sick. And
yeah.
then from a cancer standpoint, tomorrow morning I will call those cancer places and ask if we can switch over.
Okay.
But I will hold off on any biopsies until
Thank
we
you.
actually talk with you guys more.
Okay.
Thank
Excellent.
you.
We appreciate that. And then if you could look into the meds too.
The gabapentin, Neurontin, and Lexapro.
And Lexapro.
Yes. And we'll look into that, and then that'd be great if we could get her off
That'll
those.
make her better.
Yeah, and more steroids.
More steroids. Yeah.
That's what I say. Yeah.
Steroids will be directed by the neurologist.
Okay.
And I apologize. I'm basically a primary care doctor at the hospital, so the
Right.
myasthenia is managed by neurology. The cancer is managed by the oncologist.
Right.
And I'm trying to fill in the holes,
Right. I appreciate that. yeah.
of course.
Yeah. So.
Such as the gabapentin and Lexapro, and it's very much fall to me.
I have
But
told
Yeah,
that to
that's
so
awesome.
many
If we
people,
can-
and nobody's
yeah.
listened to me.
You're the first guy that's
Yeah.
even considered those. So
And
that's
you know,
great.
I mean, since you listened to that, she was having no problem. She'd never taken tramadol in her life. I asked them to give her what she knew she could take, and they gave her tramadol. She took 2 tramadol, and 20 hours later, she couldn't swallow, and this has all happened.
Yeah.
Now, nobody would listen to me on that either. I don't even know if they could revert. I don't know
Yeah.
if that makes any difference, but
Just something to look
Yeah.
into.
doesn't make any sense to me in terms of causing the myasthenia. The neurology would be the neurologist.
well,
Oh yeah.
what if it wasn't myasthenia?
Could have been induced.
What if it wasn't myasthenia? Because the test that they use wasn't approved by the FDA yet to decide that. What if that?
That's a better question for the neurologist.
Yes.
Okay.
He seemed pretty convinced based on the test, and we actually have lots of tests.
I know.
That aren't
Yep.
FDA.
I've been following the test.
Oh, he said they have lots of aren't
I-
approved. Yeah.
Yeah. Yeah.
But that I kind of have to defer to my expert. And
Yeah.
my
Okay.
understanding is he felt that's what this is.
Okay.
Yeah.
Yeah. That makes
Yep,
sense.
It does. Well, thank you so
Yes.
much.
And we will be in touch, or you'll be in touch with us tomorrow.
I will touch bases with the cancer doctors tomorrow, and
Okay.
I will, as soon as I can get back to a computer, I will get rid of the gabapentin and Lexapro.
Thank
Yay.
you. Okay, yay.
Yay.
So they can probably take that out tomorrow because
Yay.
they're
Okay,
going to stop
cool.
giving you the stuff that's
And then,
making
do you have the list of people who are allowed to get information, like that you're allowed to talk to?
There was a contact list that listed you 3, but I didn't see anybody else. It doesn't say specifically
Okay, it does list Carrie.
you guys were contacts.
Okay, well, is Carrie on the list because that's her daughter? Yeah. Because they wouldn't tell her
Did he say-
anything last night.
Yeah, they said that I wasn't on a list anywhere.
The nurse wasn't very nice.
Say your name one more time.
Carrie Hegwald is her name. It starts with a K. Yeah, Keri.
I thought it was Gary, is what I thought.
Oh,
Oh no, it's a K with a Carrie. Carrie, you know.
yeah.
Carrie.
Yeah.
I wonder if we just had the wrong. And you're her son?
And I'm the son, Scotty.
Scotty.
Yeah, I'm Scotty, and then Carrie's her daughter.
Carrie's her daughter. Okay,
Yeah.
let me double check.
Okay,
I don't have
because
access to modify that part, but I can still put it on a sticky note on the chart.
okay, yeah, that'd be great. Yeah, because they wouldn't tell her anything last night, and we didn't know why. Yeah.
Wow.
Sorry, that doesn't make any sense to me.
Yeah. Well, it probably wasn't your fault, you know.
No.
All right, well, let me get back to the computer and
Okay.
Am I gonna be on
Okay.
that list?
Huh?
Okay,
Am I
great.
gonna be
Well, I
on that
really
list?
appreciate your time and
I-
efforts, and
We're
we'll
gonna be what?
talk to you later
Am I gonna be on
tomorrow.
that list?
Sounds good.
Is,
Okay.
I think you are.
Yeah,
I
you're
think.
on the list.
Yeah.
Yeah.
I have 12 hours to see everybody. It's hard to predict when I will actually.
Right.
Sometimes it's morning, sometimes it's not.
You want me
Yeah.
to?
If I catch you, I talk then. If not, I usually try to call later when I can sit down again.
Right. Okay, that makes sense. So it'd be nice to meet you face to face someday. But yeah. All right.